Hello, today I will be discussing social anxiety disorder. Social anxiety disorder, also referred to as SAD, is a common mental health condition characterized by intense fear and embarrassment in social situations. It affects millions of people worldwide and can interfere with daily life, causing significant distress and impairment. The exact cause of social anxiety disorder is not well understood, but it is believed to involve a complex interplay of genetic and environmental and cognitive factors. Today, I will examine the various factors that contribute to SAD, including evolutionary psychology, safety behaviors, brain function, pharmacological treatment, and psychotherapy treatment, in order to gain a deeper understanding of this debilitating condition. As I mentioned in the previous slide, SAD is a mental health condition characterized by intense fear and discomfort in social situations. People with SAD experience intense self-consciousness and fear of judgment from others, leading to avoidance of social situations and significant impact on daily life. The fear is often out of proportion to the situation and may interfere with work, school, and personal relationships. However, SAD is treatable with certain therapy and medications. It's important to note that SAD can develop due to a combination of these factors, and that everyone's experience is unique, and the exact causes of SAD are not fully understood. But a few things that could contribute to SAD are genetics. SAD may run in families and have a genetic component. Brain chemistry, imbalances in neurotransmitters such as serotonin may contribute to SAD. Environmental factors, childhood experiences such as traumatic events or overly critical upbringing can increase the likelihood of developing SAD. Learned behavior, observing others who exhibit fear or anxiety in social situations may lead to learned behavior. Personality traits, people with introverted or perfectionist tendencies may be more prone to SAD. Evolutionary psychology is the study of how psychological traits have evolved in response to survival and reproductive challenges faced by our ancestors. It aims to understand how the human mind has adapted to the environment over time. Understanding evolutionary psychology provides valuable insights into the development of social anxiety disorder. According to evolutionary psychology, SAD may have evolved as a way to monitor social standing and avoid rejection by helping individuals conform to social norms. In ancestral times, being rejected by a group would have had serious consequences because survival often depended on social support. Although this heightened sensitivity to social evaluation may have been an advantage in ancestral environments, in modern society, social rejection is less likely to have life-threatening consequences and can be problematic and lead to symptoms of SAD. To cope with this fear, individuals with SAD often engage in safety behaviors, actions taken to reduce the perceived risk or discomfort of a situation. These behaviors can include avoiding eye contact, hiding physical symptoms, relying on alcohol or drugs, staying near exits, and over-preparing for social situations. Although safety behaviors may provide temporary relief from anxiety, they can have negative consequences in the long term, reinforcing the fear of social situations and increasing the individual's dependence on them. Understanding the role of safety behaviors in SAD and learning to reduce their use is an important step in overcoming SAD and managing anxiety in social situations. Brain function plays a significant role in social anxiety disorder. SAD has been linked to abnormal brain function, specifically in the regions involved in emotional processing, attention, and memory. Research using neuroimaging techniques such as functional MRI has shown that individuals with SAD have heightened activity in the amygdala, a region of the brain associated with fear and anxiety. At the same time, they have reduced activity in regions such as the anterior cingulate cortex and the medial prefrontal cortex, which are involved in regulating emotions and processing social information. Neurotransmitters are the chemicals that transmit signals between nerve cells and regulate various functions in the brain, including mood, emotions, behavior, and perception. They play a crucial role in communication within the central nervous system. When a nerve impulse reaches the end of a nerve cell, it triggers the release of neurotransmitters into the synapse, which is the space between two nerve cells. The neurotransmitters then bind to specific receptors on the receiving nerve cell and transmit the signal across the synapse. Different neurotransmitters have different functions. Studies suggest that in individuals with SAD, there are alterations in serotonin, dopamine, and norepinephrine. Serotonin is known for its role in regulating mood and social behavior and is thought to be involved in SAD due to its role in regulating anxiety and fear. Dopamine involves regulating attention, motivation, and pleasure. Low levels of dopamine have been linked to increased anxiety and reduced pleasure, which can contribute to the development and maintenance of SAD. Norepinephrine is involved in regulating arousal, attention, and alertness. Elevated levels of norepinephrine have been linked to increased anxiety, especially in social situations. Understanding the role of neurotransmitters in the brain can help in the development of effective treatments such as medications and psychotherapy to regulate their levels and function and improve mental health outcomes. Selective serotonin reuptake inhibitors, also known as SSRIs, are a type of antidepressant medication that increases the levels of serotonin in the brain, helping to regulate mood and improve anxiety symptoms. Serotonin norepinephrine reuptake inhibitors are a type of antidepressant medication that increases the levels of both serotonin and norepinephrine in the brain, helping to regulate mood and improve anxiety symptoms. Beta blockers are a type of medication typically used for heart conditions, but they can also be used to manage physical symptoms of anxiety, such as rapid heartbeat, shaking, and sweating. Benzodiazepines are a type of medication that works by reducing the activity of neurotransmitters in the brain, helping to reduce anxiety symptoms. It is important to note that medication alone is not always enough to treat SAD and may need to be combined with psychotherapy, such as cognitive behavioral therapy or CBT, to achieve the best outcomes. While medication can be helpful in managing the symptoms of social anxiety disorder, psychotherapy can also be an essential component of treatment. Psychotherapy can help patients identify and challenge negative thoughts and beliefs that contribute to social anxiety, leading to reduction in fear and embarrassment in social situations. It can teach patients coping skills and strategies for managing and reducing their anxiety in social situations, such as deep breathing and progressive muscle relaxation. Psychotherapy can also help patients improve their social skills and confidence, allowing them to better interact with others and reduce anxiety in social situations. Lastly, psychotherapy can encourage patients to gradually engage in activities that trigger their social anxiety, allowing them to build confidence and overcome their fear in a controlled and supportive environment. Overall, psychotherapy can be an effective approach to treating social anxiety disorder, helping patients to manage their symptoms, improve their quality of life, and achieve their goals. Social anxiety disorder is a complex condition that is influenced by a combination of genetic, environmental, and cognitive factors. Evolutionary psychology suggests that social anxiety may have developed as a protective mechanism to avoid danger or social rejection. However, this fear can become excessive and interfere with daily life. Safety behaviors, such as avoiding social situations or relying on alcohol or drugs, can exacerbate symptoms and perpetuate the cycle of anxiety. Recent advancements in brain imaging have shown the social anxiety disorder is associated with abnormal functioning in certain regions of the brain, such as the amygdala and the prefrontal cortex. Both pharmacological and psychotherapy treatments have been shown to be effective in managing symptoms of social anxiety disorder. Medications such as selective serotonin reuptake inhibitors, can help to regulate neurotransmitter levels and reduce anxiety. Psychotherapy, such as cognitive behavioral therapy, can help individuals identify and challenge negative thoughts and beliefs and develop coping skills to manage social anxiety.